Welcome back to TV5 News at 9. Today we are talking about open enrollment for healthcare. Joining us this morning from Hamilton Community Health Network is Tim McCarran. Thank you so much for joining us.
Yeah, thank you for having us.
So what is the importance of open enrollment periods and when are they?
So a lot of people might miss the open enrollment period if they're not accustomed to maybe looking over their health plans every year. So they are important so that you don't miss out on either getting health insurance or making changes to what you already have.
And when are those periods?
So we're in the open enrollment period for Medicare right now. Their main open enrollment is from October 15th to December 7th. And then for the marketplace plans through the Affordable Care Act, the open enrollment period will start November 1st, and that'll go until December 15th.
So what are some of the things that people should have with them when they are applying?
Yeah, so a lot of people might start the process and then realize that they don't have certain things in front of them that they need. So the main thing is always going to be income. So you want to know how much you make, whether it's per hour and then how many hours you work on average or just what you've made for the whole year. Just kind of have that in front of you, as well as any dependents or your spouse's social security numbers, dates of birth, all of that.
Okay, this is some good information. And also, what are some things that people should look for when they are comparing different plans?
So the main things that I think get looked over every time is you want to make sure that whatever medications you're taking or that your family is taking, that is on the formulary or the drug list that plan covers. And usually there's a button to click once you go into plan details where you can easily search for whatever medication it is. And you just want to make sure that you find the exact one. And then same thing for doctors. So whether it's a specialist doctor or your primary care physician, just make sure that they do take the plan and that they're in network.
And I know this can kind of be confusing for some people if they're just new to it. So how should people be looking over their options?
If they are not comfortable doing it by themselves, then there are people there's people like me that do this kind of thing all the time. So the easiest way is if you go to healthcare.gov, there's a link at the bottom of the page to find local help, and you just put in your zip code and it will give you all the people in your area that do it. Some will say agents, and they normally work for a specific health plan, but you can also just look for assisters. But all of us are non-biased, so we will just help you find what you're looking for, and you don't have to worry about getting pushed into one particular plan.
Are there any common problems that when you're talking to these people, that they typically have?
Yeah, especially with, say, the marketplace plans, it requires you to have email. And so for some people, that's not commonplace like it is for most of us. So trying to go through those first steps to authenticate who they are and their identity can be a little bit foreign for some. But, I think the most important part is just to understand that we just have to make sure that it's you, and once we get past that point, we can go ahead with the application and then show you all the health plans that you qualify for.
Well, this is some great information. Thank you so much for taking the time to speak with us today.
Yeah, no problem. Thank you for having us.
And if you would like any more information, you can check out the hot link section of WNEM.com.